Hello, my name is Jamel Monique Hoy, and today I'll be performing my head-to-toe assessment for the fall of 2022. Today is August the 23rd, 2022. I've already performed hand hygiene and identified my patient, so now I will move forward with scanning my room. So we have our patient. All right, so got our Snelling chart that'll be 6 feet from our patient. Okay. So throughout this assessment, I will be assessing my patient's skin for color, temperature, moisture, texture, edema, turgor, bruising, scarring, lesions, and nevi. I will first start off with my head and face, and I'll be looking for my patients, looking for size, shape, symmetry, midline position. I will then go ahead and palpate the head and scalp, and I'll be checking for hair distribution, hair color, hair texture, looking for any depressions, infestations, tenderness, or masses. Then I will move forward with palpating my temporal arteries for any tenderness. Any tenderness? No? Okay, so now we'll go ahead and move forward with our lymph nodes. We'll start with our preauricular, postauricular, occipital. We have our tonsillar, our submandibular, submental. We got our anterior cervical chain, posterior cervical chain, and supraclavicular. Then we will go ahead, I will palpate the TMJ. I'll be checking for any subluxation, crepitus, or tenderness by having my patient to open and close their mouth. Okay, and then we'll go ahead and assess cranial nerve number 5 by having my patient to clench down their jaw as I palpate over the masseter-mosum. Okay, so then we'll go ahead and assess the sensory portion of cranial nerve number 5 by having my patient to close her eyes while I touch various parts of her face.
Forehead, cheek, nose, cheek, chin.
Okay, next we will assess cranial nerve number 7. And we'll be checking for facial symmetry as I have the patient to smile, frown, raise her eyebrows, pucker her cheeks, pucker her lips. Okay, so then we'll go ahead and move on to our ears. I'll start by assessing the shape and placement of our ears. I'll be palpating the pinna and the tragus for any tenderness or any masses. Then I will move forward to inspecting my auditory canal and tympanic membrane. Okay, so then next I will go ahead and I'll be performing a series of tests to assess cranial nerve number 8, which is our hearing. The first of which will be the whisper test. Occlude your left ear and whisper what I say.
1, 2, 3.
Okay, and occlude the other ear.
ABC.
Okay, so then we will move forward with our Weber test, checking for lateralization. I'll strike this fork and I need you to tell me if you can hear it on the right, the left, or both sides equally.
Both sides.
Okay, so then we move forward with our Renee test, and we will be assessing for air conduction versus bone conduction. I just need you to tell me when you stop hearing it.
Now. Now.
Okay, air conduction is greater than bone conduction.
Now. Now.
Okay, air conduction is greater than bone conduction. So next we'll move forward to our eyes. I start by assessing the eyebrows, the lashes, and the palpebral fissures. I will then move forward to assessing our sclera and our conjunctiva for any lesions, colors, and discharge. Then I will go ahead and I will start by assessing cranial nerve number 2, which is our visual acuity. So I'm gonna get you to take a look at your Snelling chart, and I want you to read off the lowest line that you can read. Cover your right eye for me.
PFODTEL.
Okay, and your left eye.
PFODTEL.
Okay, and then both eyes.
PFODTEL.
Okay, then that will be our 20/20. So then we'll move forward with peripheral vision. I'm going to tell me whenever you can see my fingers coming to view, okay?
Now.
Okay.
Now.
Okay. So then we will go ahead and we move forward with cranial nerve number 3. And we will be assessing for our pupillary reflexes to a light. So we will get our pen light and just take a look at the light, the wall behind you. Okay, so then concentric light reflex, I'm going to take a look into your right eye, shine the light in your right eye while looking in your left, and then I'm shine the light in your left eye while looking into your right. Okay, so then we will move forward with our accommodation and conversion. So what I want you to do is to take a look at my, well, first we'll do 3, 4, 6, cranial nerve 3, 4, 6. Take a look at my fingers and follow it. Okay, so look at the wall behind you. That's accommodation, and then follow my finger to your nose, and that's convergence. Okay, so next we will go ahead and we'll take a look at use our ophthalmoscope to take a look at the optic disc. Okay, vessels are present. I'm sorry. Make sure I keep you on your account. All right. So then we will move forward with our nose. I will look for placement, midline position. I'll go ahead and I'll have you to occlude your right nostril and breathe in, and your left nostril and breathe in. We just check up a nasal patency. Then I'll get you to close your eyes, and I'm gonna let you smell something. You tell me what it is.
Alcohol.
Alcohol, that's correct. Okay, and then I'll go ahead and I'll palpate your frontal and maxillary sinuses. Any tenderness?
No.
Any tenderness?
No.
Okay. So next we will go ahead and we will move forward to our mouth. So I'll start by assessing the lips, the teeth. Let me get my light again. The lips, the teeth, the gums. I'll take a look at the soft palate, the uvula, the posterior pharynx, and the tonsils, and grade the tonsils if they're present. Can you say ah? Okay, her tonsils are not present. Okay, so then we'll assess cranial nerve number 9 and 10. Well, I'll get you to say ah. Okay, and the uvula and the uvula and soft palate does ride with phonation. And then I'll get you to assess cranial nerve number 12. Stick out your tongue, move it left and right, and it remains midline without any fasciculations. So then I will go ahead and I will begin my throat. I'll just take a look at the trachea, palpate the trachea, it should be midline position. Then I'll go ahead and palpate the thyroid. I'm gonna get you to swallow. Okay. Then I'll feel for our carotid pulses. Let's go this side. All right. All right. And then I'll also go ahead and listen over our carotid pulses for any bruise with the bell of my stethoscope. Take a deep breath in, hold it. Okay. Deep breath in, hold it. Okay. Then next we will move forward with our posterior chest. So I'll get the patient to turn around and I'll be looking for any signs of respiratory distress such as use of accessory muscles, tripod position, nasal flaring, any tachypnea, any cyanosis. I'll then go ahead and I'll palpate for symmetrical chest expansion. Take a deep breath in. Okay. And then I'll go ahead and also palpate for tactile firmitis. Say 99 whenever you feel my hand move.
99. 99. 99.
Okay. Then I will go ahead and I will percuss over the intercostal spaces. Okay, and then after percussing, I will go ahead and I will auscultate over the intercostal spaces, over the posterior long fields. Take a deep breath in and out. And we will be starting above our scapula when doing such. And making sure we're getting down into this right lower lobe. All right, and then while we're back here, we'll also listen for egophony. So whenever you feel my stethoscope move, say E.
E. E. E. E. E. E.
Okay, and then we'll move forward with bronchophony. Say 99.
99. 99. 99. 99. 99. 99.
And what's the pectorally? Say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so then I'll get the patient to turn back around for me. And we'll basically repeat this in the anterior portion. I'll be looking for any asymmetry in our chest, as well as I'll go ahead and feel for palpate for symmetry, for chest expansion, and then I also palpate for tactile firmitis. Can you say 99?
99. 99. 99.
All right, so then we'll go ahead and we'll auscultate again over our anterior lung fields. All right, so next we'll move forward with our aortic, our heart portion of the assessment. I'll first start by auscultating over the aortic. So we're starting the right sternal border. We'll listen to our aortic in the second intercostal space. Pulmonic left sternal border, second intercostal space. Herbs, we have the third intercostal space, left sternal border. We got tricuspid, the fourth intercostal space, left sternal border, and then we have mitral, midclavicular fifth intercostal space. And we'll do this with the bell as well. Okay, so then I will identify and palpate my PMI. Okay, and then I'll also go ahead and auscultate for 1 full minute over the apical pulse, and I report the rate and rhythm. And I will get the rate and rhythm. So then we will have my patient to lie down. I'll move this closer. Oops. It's about to fall. Come on, don't. This thing is giving me trouble. I'm sorry. Having technical difficulties right here. Okay. I'll be assessing for, you want to put your head on, for JVD, jugular vein JVD, and also looking for any heaves or any lifts. I'll go ahead and palpate over the, over our parts that we will listen for our heart sounds, for any thrills. So aortic, pulmonic, herbs, tricuspid, and the mitral. And then I'll go ahead and repeat my cardiac listening to my heart sounds. Aortic, pulmonic, herbs, tricuspid, and the mitral. And then we'll also repeat that again with the valve, aortic, pulmonic, herbs, tricuspid, and the mitral. So then I will go ahead and I will assess my patient's abdominal. And for privacy reasons, we won't raise her shirt, but we will go ahead and I'm looking for any abdominal contours. I'm checking for, I'll go ahead and I'll listen for my aorta for any bruise. Let me get down to my patient's level. So I've got the aorta, the renal arteries, the iliac arteries, and our femoral arteries. All right. So then we'll go ahead and I'll go ahead and listen to all my bowel sounds in all 4 of my quadrants. And then I'll also go ahead and I'll percuss over all 4 quadrants. And then I'll perform light and deep palpation for any masses or tenderness. So we do light palpation as well as deep palpation. So then we will go ahead from there. I will assess for I will assess for the liver and palpate the liver and the spleen. The liver on my right upper quadrant and the spleen on my left upper quadrant. And in normal circumstances, it shouldn't be palpable. So then I will get my patient to sit back up for me. And I'll get you to get back in the chair. And I'm gonna check for CVA tenderness. Okay. Okay. Any tenderness with that? No. Okay. So I'll get you to turn back around. So from here, we will go ahead and we will start with our musculoskeletal. We will first start by checking your capillary refill. Okay. And I'm just basically looking at the joints of the fingers, the hands, the fingers, the wrists, the hands. I'm looking for any deformities, any swelling, any deformities. Let me move this speaker just a little. Any nodules, any crepitus, anything out of the normal with this. So I'll go ahead and I will feel your radial pulses. Okay, so then we'll start with our range of motion of our fingers. We'll do flexion, extension, hyperextension, abduction, adduction. So then we move to our wrist. We will do flexion, extension, hyperextension. We got ulnar deviation, radial deviation, and then we got rotation. So then we got our up our shoulders. We got flexion. No, our shoulders. So we got flexion, extension, hyperextension. We got internal rotation, external rotation, and then we got circumduction. Then we got to do our elbows. So we got flexion, extension, and hyperextension. So then we will go ahead. We will start with assessing our strength of our extremities. So squeeze my hand as tight as you can. Okay. Then we'll stress the strength of your elbows. So I'm gonna get you to pull up. So push against me and pull against me. All right. And then also the strength of your shoulders. So I'm gonna get you to do like this for me. So push up Push down. Then we'll assess cranial nerve number 11 by doing our shoulder shrugs. So I need you. All right. So then we will move forward with our next. Okay, our cerebellar coordination. We would do thumb to finger opposition. So then we got hand flip flop, and then we got finger to finger. All right, so then we will assess for sterignosis. I'm gonna get you to close your eyes, and I'm gonna put something in your hand, and I want you to tell me what it is.
Paperclip.
Okay, and then I got you something else.
Q-tip.
Q-tip. Okay, good job. And then graphesthesia, I will go ahead and I will draw something in your hand.
2.
Okay.
4.
Okay, so that assesses for that. So next we'll move forward to, how am I doing my time? Next we'll move forward to our lower extremities, and I'll be assessing for the color, the temperature, and moisture. I'm looking for any edema in her lower extremities. I'll go ahead and I'll palpate her pulses, dorsalis pedis, and posterior tibialis. All right, so then we'll go ahead and we'll start our range of motions with her toes. So we got flexion, extension, hyperextension. Well, I did that back. So flexion, extension, hyperextension. We got abduction, adduction, and we have, so then we go to our ankle. We have our dorsiflexion, okay, then plantar flexion, and then we got rotation. So then of our knees, we got flexion, extension, hyperextension, flexion, extension, hyperextension. Okay, and then of our, so then we will go ahead, I will assess for the strength. So if you can pull up for me, push down against me. Okay, and then I want you to push out, push in, okay, push in, push out, okay? So that will be that. Then we will go ahead and get you to stand up, and I will start with my, we will do rotation, range of motion of our hips. So let's see, I'm gonna get you to, can you see me? Okay, so we're gonna do flexion, extension, hyperextension. We got flexion. Oh, we're gonna do the, I'm sorry. Flexion, extension, hyperextension. Then we got internal rotation, external rotation, internal rotation, external rotation. We got abduct and adduct, abduct and adduct. Okay, so then we'll go ahead and assess it of our knees. So we got flexion, extension, hyperextension. We got flexion, extension, and hyperextension. Then we'll go ahead, next we will assess for, we will do our deep tendon reflexes. I skipped that portion. I'm sorry, but we'll go ahead and finish the part that we're up already. So I'll go ahead and I'll assess your spinal curvature. I'm looking for any signs or deformities, any scoliosis. I'll get her to lean over and just checking the spine. Okay, so then we will do range of motion of our vertebrae. So we do flexion, extension, hyperextension, lateral, and circle rotation. Okay, and then also of our cervical spine, we do flexion, extension, hyperextension, lateral, and rotation. So then we'll get you to do the Romberg test. I'll get you to close your eyes, hold your hands out, and I'll just watch you. Okay, then I'll check your gait. I'll get you to walk towards me, normal, and then I'll get you to walk back in tandem. Okay, and then I'll get you to hop in place on one foot. Okay, and then next, we're gonna go ahead and knock these, each and reflexes out before we run out of time. Okay, so we have our brachioradialis. Okay. We have our biceps. Okay, then we have our triceps. I'll hold the weight of your arm. Okay. Okay. Then we'll go ahead and do our patellar. All right. All right. Our Achilles. All right. And the Babinski. All right. And that concludes our head to toe assessment.